Hey everybody, this is Dr. Matt Joosse at Joosse Family Orthodontics in Williamsburg, Virginia. I wanted to show off a case that we recently completed. This is a case of early treatment, or what we call phase 1 treatment. And we like to see kids when they are 7, 8 years old. It's a great time to intervene when there are problems that exist, and there are certain indications for doing early treatment. In the case of Emma here, we have extreme crowding that if we didn't do anything about, we would likely have to take out teeth later on, take out adult teeth. And so our phase 1 intervention is all about trying to reduce the possibility of extraction of teeth. There are also some functional considerations. She has what's called an anterior crossbite, which I'll show you in a minute. And this is something that can affect the growth of the jaws. So right there, you'll see that severe crowding is one indication for early treatment. Another one is conditions that will affect the growth of the jaws. And those are reasons to get involved early. So this was Emma when we met her. She was 7 or 8 years old, and I'm going to show you a little bit closer up of her teeth. We are using an intraoral scanner right now to take our intraoral pictures. This is a much more pleasant experience than using traditional camera and mirrors. This is really easy, even for a small little mouth like Emma. What you can see from where Emma started is you can see that this upper left front tooth is behind the lower front teeth. And so this is the functional consideration. We call that an anterior crossbite because the upper tooth should be to the outside of the lower teeth. And as you go backwards here towards the left, you see other teeth that are to the inside of these lower teeth, again, creating a crossbite situation. This crossbite affects the growth of the jaws because it doesn't let the upper jaw grow quite like it should. And at this stage of her development, the upper jaw should be growing more than the lower jaw. So I'm going to show you a picture of her upper teeth. This is as if you were standing on her tongue, looking up at her upper teeth. And what you see here is a lot of crowding. And this is actually what brought Emma into our office, was this severe crowding. You can see right here, this is the upper right lateral incisor. That tooth belongs between this one and this one. So this whole tooth belongs in that little bitty space. And you didn't have to go to orthodontic residency to know that that is very, very crowded. On the other side, we had the upper left lateral incisor erupting right here. And this tooth belongs in this space right here between the central incisor and the baby canine tooth. So again, very, very crowded. We treated Emma with a palate expander and a couple of braces that went on, mostly just the front teeth and then 2 in the back. And the palate expander made the upper jaw bigger because at its root, this is a jaw size problem. So we made the upper jaw bigger, and we can do that in young and growing kids. We can actually make the upper jaw bigger in a very easy way because the jaw is 2 distinct bones that can be moved apart very easily. We added a couple braces to be able to move these lateral incisors forward. And so you see really, really great alignment of those upper teeth. Again, that's where we started, and that's where we ended with those upper teeth. So quite an amazing change. If you look at this kind of center photo here, you can see that we have the upper incisors now to the outside of the lower incisors. So we restored that functional environment. Now the jaw growth can resume as normal. And as an added byproduct, things look a lot nicer too. So we weren't involved in Emma's early treatment for aesthetic reasons, but if you're in there and you're gonna take care of all these functional things, you might as well make it look good as well. So what I consider to be a huge success for Emma, we've got a much nicer smile, so she has a lot more confidence about the way that she smiles. We've got the upper incisors forward of the lower incisors, so now jaw growth can resume as normal. And we corrected some really, really crowded teeth, and hopefully we've avoided tooth extraction for Emma in the future. So she should be able to keep all of her adult teeth when they all come in the future. So we finished Emma's treatment. She's 9 years old right now, and we will likely take a few years off. We'll let the baby teeth get lost, and we'll have the other adult teeth come in. If we need a second phase of treatment to make sure that the bite fits together properly, or to put some finishing touches on her smile, we'll of course do that in the future. But this is a great example of early treatment, and a great example of why we like to see kids young at age 7 and 8, so that we can intercept some of these problems before they become really big problems. Hope you enjoyed seeing that. Thanks, and take care.